What is and what has been the impact on the labour force, particularly when it comes to women, as a result of these lockdowns?
So I looked at the data for the first month of the lockdown, which, as you know, in India was very stringent. Now, given that we had very significant pre-lockdown gender disparities in labour force participation and employment, in absolute numbers, more men were employed pre-lockdown and more men lost jobs post-lockdown, which is contrary to the trend that we are seeing from the early results in the United States. But if you condition on who had jobs before the lockdown, so relative to pre-lockdown employment, women lost out relatively more than men. So that's the sort of Indian peculiarity. So in relative terms, women have suffered greater job losses. And given that there are already issues and constraints that show up in a lower labor force participation rate of women, this doesn't bode very well for the future.
Professor, what do you understand is the likelihood of the women who have been pushed and forced out of the workforce being able to quickly get back into employment, given the informal nature of a lot of this work? How likely is that to happen, and in what kind of time frame?
So the early results for May and June the early data that has come out shows that employment has picked up, although it is at a very low level in rural areas. So there is a rural employment guarantee program, and applications to that program have risen dramatically because that's all the work that's available in the rural areas. And in that sense, we'll have to wait for the numbers, and it's possible that women's labor force employment might also go up. But as you say rightly, it's likely to be in low-end, informal, vulnerable occupations, and not the kind of formal sector, good, decent jobs that you would expect in going ahead in the long run. But I think that the pandemic also offers the country an opportunity to reorganize many things. And if those opportunities are seized, maybe we might see a different result.
Ashwini, it's a tragedy what happens with Dalits, otherwise known as untouchables, a low caste, and if you're a woman simultaneously, your options are very limited, aren't they?
Yes, they are. So the unfortunate thing is that there are many stigmatized jobs at the bottom end of the occupational spectrum, which have been the traditional occupations of Dalits. And these jobs, they continue to do. So in that sense, they are 100% represented in these jobs, which is not a good situation. The other thing about women, this has nothing to do with caste, but the fact is that the people who are in the front lines of the COVID fight, these are the primary health workers called Ashas, or the auxiliary nurses and midwives, whose normal job is not to deal with disease prevention, but because the COVID pandemic has been so huge, they have been put into the jobs of contact tracing, information giving, doing a survey, checking up on families. So they are literally going from house to house, the ASHA workers and the ANMs, going from house to house, talking to households, giving them information about COVID, and also doing contact tracing. Now, this is, it's unbearably hot. These women are doing these jobs under the most hazardous conditions without any protective gear, and they risk coming in contact with patients who might have COVID. So on the one hand, you see a drop in their employment. On the other hand, you see that when you think of the stigmatized jobs that Dalits do, or these very risky frontline health jobs, they seem to be sort of exclusively reserved for women, which you might say, well, at least they have some jobs. But yes, but it's, it's risky. It's risky. It's hazardous. It's risky. It's putting them at the risk of stigmatization from their communities. They have been isolated from their families. There have been stray incidents of violence against them or their families. So they are between a rock and a hard place.
Ashwini, has this crisis compounded existing or pre-existing inequalities there that you've been mentioning? And on top of that, what are the policy prescriptions that you would have in mind from your study? And then do you have a government, in your view, who is willing to address those concerns?
Well, for sort of the longer term impacts of the lockdown, I think we need more data, because I just analyzed 1 month of data, which was what was available to me in April. And given that there are trends of rising or lower unemployment in May and June, or rising employment, we have to see what the distribution of those who are getting employment in May and June are in terms of caste and in terms of gender. So I would like to see that data first before commenting. In general, I feel that from the experience of earlier pandemics, we have seen that pre-existing inequalities do tend to get strengthened, whether they're along gender lines or along ethnicity or caste lines. In the United States, we are seeing a very seriously racially divided impact of COVID and many of similar kinds of issues. So I do believe that based upon all of this, that it's not unreasonable to assume that we'll see the same thing in India. But of course, we need more data, which brings me to my second point, which is that we need gender and caste disaggregated data, both in terms of incidence of COVID as well as in terms of employment. And we need to have that in real time, so that all the scientific expertise that India has, and that's considerable, can be put into analyzing this data and suggesting policy prescriptions for the future. As I said before, I think because the pandemic pushed a stop or a pause button on our economies, when we unpause, when we restart, I think it's a good opportunity for us to make sure that structural constraints that were preventing equal participation of women or Dalits can be removed. I think this is a good time to make positive policy breakthroughs. And I can only hope that the government will do that.